In good health, it is a contagious virus with a very scary sounding name and some rather frightening symptoms. But local doctors say they're seeing a lot of children suffering from hand, foot, and mouth disease. Some are even ending up in the hospital. Christina Socia of Chesterfield says a fever was the first sign something was wrong with her son Noah.
I tried Motrin and Tylenol, and all night he was in my bed, and I was checking his fever all night, and nothing was working.
She took Noah to urgent care, and doctors sent them to the hospital.
He was very dehydrated. They put IV fluids in him, and so slowly he got better after a couple of days, but it was really scary.
Let's look at your ear.
Noah was diagnosed with herpes angina, a type of hand, foot, and mouth disease that causes blisters in the mouth.
If the child has lesions everywhere, we call it hand, foot, and mouth disease, and if they have it just in their mouth, we call it herpes angina, but it's the same virus.
Never heard of that before. What is it? So I went home and I researched it, and I'm like, okay, he's got all those symptoms.
Dr. Marcus DeGraw at the St. John Children's Center says in spite of the scary-sounding name, hand, foot, and mouth disease is very common in younger children.
Doesn't cause many major side effects or bad outcomes. It's just simply not feeling well for a few days and then it goes away.
The biggest concern, dehydration.
Where their mouth hurts or their throat hurts and they're not wanting to eat and drink, then we have troubles.
As for little Noah,
he's great. He's back to his normal self, playing, going crazy, getting into everything, just a normal, almost 2-year-old. Dan, do you smell like salt on me?
Well, hand, foot, and mouth disease is spread from person to person and by touching contaminated surfaces, so frequent hand washing is the best way to protect your family. You can learn more about the virus at clickondetroit.com/health.